The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
So I'm Dr. Josh Gonzalez. I think this is going to be an interesting chat today because Brian and I are going to sort of tag team this interesting topic that I think we come across a lot in our practices. Brian and I have been friends, colleagues, co-founders for years now. It's been a real pleasure to kind of go on this journey, having co-founded Popstar together and really grown this brand. And we like to use our voices and our platforms to kind of help educate patients and customers like yourself on various sexual health topics. So today we're going to really be focusing on sexual health as it relates to couples, which, you know, I think this first slide really illustrates that sexual health, even if it hasn't been treated as such by medicine historically, is really not a solo sport. It's a something that exists between two people or sometimes more than two people. And so, you know, I think when we see patients in our office, the way that we've been taught to think about it is like, you know, a patient comes in, it's usually in our practices, a male patient comes in, they're embarrassed, they're ashamed, and oftentimes they're alone, and they're there to talk about a specific symptom. Sometimes we have to kind of drag it out of them to get to understand why they're in the office to see us. And they may be wanting to talk about their erectile dysfunction, or maybe problems with ejaculation, or maybe they've lost interest in sex. But we've been sort of taught in our medical education to treat the person as an individual and not as like one part of an overall sexual experience. And that's just, you know, the problem with that is that that's not how sex works. And that sex, you know, at its best is really a shared experience between partners, and that involves, you know, feeling vulnerable, being able to communicate, making sure that the experience is pleasurable between partners. And it really is a team sport. And so we have really tried to shift our thinking in how we treat that individual in our practice as one part of a larger team. Because if you treat the individual and you're not, you know, at least asking about their partner, then you're really sort of missing the boat.
Thanks, Josh. I mean, I want to echo what Josh said. In my patients, I find what's most important here is, you know, inclusion, communication. Together, these lead to stronger relationships, both inside and outside of the bedroom. What we know is that couples who work together through issues or share desires together have been shown to have higher success rates and have better sex. So when we talk about what couples are actually struggling, we can kind of talk about two things. We can talk about actual medical conditions that may be impacting these patients. What I hear sometimes is that we're bored, right? Not that we just have these issues like low libido, erectile dysfunction, curved penises, ejaculatory issues. A lot of times I'll meet with couples who are saying to me, there's not one big issue that I'm dealing with. It's that together the relationship isn't as profound, or the communication suffers, or the desires that one person has isn't being met. And so if something feels off, oftentimes couples won't talk about it, right? They don't want to make it feel weird. They want to avoid the conversation, and that's totally normal. But it's important to point out that as relationships grow, as bodies change, as stress happens in life, biology doesn't really care about your schedule. And so keeping in mind that couples struggle for a lot of different reasons that are individualistic, and pay attention to what matters to you, and keeping those communication lines open is absolutely critical for a relationship.
Yeah, so continuing on that point, right, there's a lot of things that we hear in our office that go unsaid within a relationship, right? And so one of the things that we try to do is encourage our patients to not, you know, end that conversation with in the office, but to continue to have it outside of our office with their partner. So when it comes to things like timing, right, we hear a lot, we're just never in the mood anymore, right? Or when I want to, she's exhausted or doesn't want to, or when he's interested, I'm stressed about work, right? There's timing issues that can come up in relationships. When it comes to confidence, we hear, I'm worried that I'm not going to be able to perform. When it comes to energy, we all have busy lives, right? By the time we get home from work and we have dinner and the kids get put to sleep, I just don't have the energy anymore to engage in sexual activity with my partner. And then when it comes to enthusiasm, there can be discrepancies there where, people will talk about, they know that their partner just is into it. Maybe they're going through the motions, but and willing to have sex, but they don't seem excited about it anymore. And so why people aren't having these conversations, I think, is because it requires a real vulnerability, which people tend to shy away from, but is incredibly important to sort of reach that next level with your partner and really sort of reach your full sexual potential, because being intimate with someone does require some degree of vulnerability. And not only that, if those things are left unsaid, they're just going to continue to fester and create more problems. And it's not as if these problems, if ignored, are going to go away. So one, initial step at sort of is saying the quiet part out loud, right? You need to voice these things. You need to communicate these things with your partner.
When we see patients in our practice, there are 5 major issues that we see oftentimes impact couples when it's coming from the male side. And those are erectile dysfunction, a difficulty achieving or maintaining an erection, low libido or desire, which typically is another way of saying issues with testosterone. The third thing we often talk about is a curved penis, something called Peyronie's disease, and issues with penetration, painful sex, difficulty with erections that come with it. But one of the things that's often neglected is the idea of semen health. And by semen health, I mean semen volume, semen taste, the consistency of semen, recovery time, or the ability to have sex multiple times. But in a way, semen, or the act of ejaculation, really is just another way of defining the orgasm, right? And it's a concept that we don't talk about a lot. We obsess over erections. The media talks about testosterone. There's commercials everywhere. But one of the things we oftentimes neglect, which can impact couples and impact a relationship, is the orgasm. Both the male orgasm, its intensity, its consistency, and can you actually make it better, as well as the female orgasm, ensuring both partners in the relationship are satisfied. What we know is these things change over time, and they matter more to guys than a lot of people realize. So it's important always to have an open conversation with your partner, both about erections, about testosterone, and about ejaculation, semen, and orgasm.
Okay, so what do we mean when we, what are we talking about when we say, what affects semen health, right? Because it's probably a pretty new concept to a lot of people listening to this. So let's talk about the things that affect it, right? So we know that starting around age 30 to 35, men will typically start to experience some sort of gradual decline in their semen volume. So it is something that occurs naturally as we get older, but it doesn't mean that there's nothing that can be done about it, or that it's sort of somehow an inevitable part of aging, right? So there is an age factor. Hydration is also incredibly important. So semen is about 96 to 98% water. So if you're chronically dehydrated, it's going to affect not just your kidney function, but your semen health as well. You may notice that the consistency is thicker or less fluid-like if you're sort of chronically dehydrated. Frequency of ejaculation. So if you are ejaculating every day, each ejaculatory volume will probably be lower than if you were to abstain for 2 to 3 days between ejaculation. Other things like diet and nutrition can be important. So there's nutrients that are crucial for semen production, things like zinc, L-arginine, certain vitamins, selenium. All of those things are involved in the production of semen, and so certain dietary deficiencies can cause problems with semen production. And then, of course, there's medications, right? So that affect semen health. Those include everything from antidepressants, which can sometimes delay ejaculation, blood pressure medications, some urological medications that we put patients on to help them pee better can affect normal ejaculatory function. Medications like finasteride, which some people use to make their prostate smaller, and other younger men often will use for hair loss prevention, and some even allergy medications. All of these things can have a negative impact on semen health. And a lot of men are put on these medications, even sometimes by urologists, and not told that they can have a negative impact on semen health. Additionally, things like stress and sleep, they can wreak havoc on a lot of different functions in our body, but can definitely negatively impact semen health. And then other underlying health conditions, some of which Brian alluded to, so hypogonadism or low testosterone, cardiovascular disease, diabetes, all of those things can have a negative impact on semen health.
When we talk about sexual activity, the vast majority of the time we're talking about you and your partner. Although I will call out that a lot of men have meaningful sexual activity with themselves, with self-play or masturbation. For the sake of the conversation, let's talk about you and your partner. And the one thing in my office I'm always surprised that men don't notice is that they think they have this minor issue. They're perseverating about it. They're thinking about it. They're seeking out treatment. And for some reason, they think their partner doesn't notice. And not only notice the actual issue, like the lack of drive or the erection that doesn't last as long as it used to, or the difficulty with ejaculation or orgasm, but they also think their partner doesn't recognize the stress that it's causing, or the focus that it's causing in the bedroom, or distraction that it's causing in the bedroom. And I can't tell you how often I have to point out to the patient in my office that their partner does notice, and oftentimes their partner notices these changes months before the patient does, or the guy that I'm seeing in the office. It's not a criticism, but it's important to point out from an awareness standpoint that you, your significant other, your partner, your husband, your wife, they're noticing these subtle changes in you, and it's having an impact both on how they perceive you in the relationship, but also sometimes how they internalize things or begin to believe that maybe it's their fault. And so for guys who often tend to be hard-headed, I want to point out that your partner is noticing these issues. It can negatively impact relationships, and having an awareness to this is actually a huge advantage. Knowing that your partner is aware of these issues, knowing that your partner is paying attention, and getting in front of it with communication can not only prevent the issue becoming bigger for you, but it can actually prevent the issue becoming one for your significant other. And so your partner is noticing, and being aware of that, owning that, and opening that line of communication can be one of the first steps to getting some real success and making sex better for both of you.
I just want to continue along that point, right? So when we talk about finishing strong, and we use this language a lot at Popstar, and the way we talk to our patients about sexual health, we don't mean, are you getting a good erection? Are you able to maintain that erection? Are you ejaculating and having a pleasurable orgasm? That's a part of it. But what we really mean is, are you finishing confidently, right? Are you, are you walking away from that sexual experience feeling confident? Because if you are, we know that that is a very powerful predictor of overall sexual satisfaction. And that's not just for the individual, but it's also for their partner, right? When you are more confident, you're more present, you're more attuned to your partner's needs and desires and pleasure, right? Maybe you're more playful, maybe you're more adventurous, you try new things, you're also more vulnerable. And that is going to enhance the overall sexual experience. And this is something that your partner will feel, right? They're going to feel your confidence, and that in turn is going to breed more confidence. They're going to feel confident in themselves, and it becomes this interplay between partners. So they'll be more enthusiastic, you'll become more enthusiastic, they'll be more confident, you'll be more confident, and then the overall sexual experience is enhanced. And that is really what we mean by finishing strong. It's really about going into these encounters with confidence rather than anxiety.
So we want to bring up a subject matter that often isn't discussed, sometimes is neglected, and is something that most urologists don't even pay attention to. And it's the idea that in sexual activity, volume and taste, ejaculatory volume, ejaculatory taste actually does matter. And the reason why this became apparent to Dr. Gonzalez and I was we were seeing two patients in our offices that were complaining of a similar issue. And so we were seeing young men who were having performance anxiety around volume, and it was impacting how they performed in the bedroom. What we were also seeing is men in their 50s and 60s who were having orgasms and less was coming out. Now, this was either a side effect from an enlarging prostate or a side effect of one of the most common medicines that men take for their prostate, something called an alpha blocker, oftentimes the most common one known as Flomax or tamsulosin. And what we were seeing in our office was that men of various different age groups were having similar complaints of a decreased ejaculatory volume. On top of that, we were seeing men who their partner was complaining about the taste of their ejaculate. We coupled that with a whole big issue regarding male infertility in this country, and we realized that semen health as a whole was perhaps a much bigger issue than we were willing to talk about. And so we wanted to be adults about it. We wanted to recognize that volume matters, that taste matters, and that fertility is a huge issue in this country. And so knowing that volume and taste is an issue, knowing that fertility is an issue, we wanted to make sure that as a whole, these conversations were being had. Because if men were experiencing issues as they aged, if young men were having confidence issues regarding volume and taste, there wasn't any solutions out there for that, and there wasn't any answers. And so it's important for men to realize that if you are having issues with semen volume, semen taste, infertility, that there are solutions out there, and it's not something you should be afraid to ask about.
So I love this idea of the confidence loop because it's just like a fancy way of sort of understanding a self-fulfilling prophecy, right? When you have a good experience, that leads to you feeling confident about your ability to have a pleasurable sexual experience. That in turn, as we mentioned a second ago, has a positive effect on your partner. It may cause you to initiate sex more. Sex gets better over time, right? So that is why our goal is always starts with confidence, because if we can give our patients, our customers, tools to go into these encounters feeling more confident, that will then create a loop in which they continue to have more frequent sex, more pleasurable sex. But I think it's also important to point out that the opposite can be true, right? You can have a negative confidence loop, right? You have performance anxiety, things don't work out the way that you want them to. Suddenly you start withdrawing, shutting down, you're no longer initiating sex. That makes your partner feel distant. You start having issues in the relationship. There's resentment, and that creates, again, this sort of vicious cycle that people go through. So we really always try to frame this conversation starting with confidence so that patients can then continue to have this pleasure, this positive loop, and realize their full sexual potential.
So Josh and I, Dr. Gonzalez and I, launched a brand called Popstar. And what it is it's real solutions to sexual medicine issues from doctors who specialize in this that you can safely trust. The science backs it. You know it's made in America. It has all the proper ingredients in it for you to feel comfortable putting it in your body. And we look at everything as a support, right? This isn't a magic trick. There isn't a easy solution to all these problems. It's not about turning yourself into a different person. It's about supporting you, semen health, semen volume through nutrition, so fewer things aren't working against you. So the way to think about this is it's almost like a pre-workout for sex, right? When you combine this with diet, when you combine it with exercise, when you put it into your routine with decreasing stress and better sleep, all of these things together will lead to a better sex life. And so we like to think of sexual medicine just like you would workout. There's something you do for a pre-workout, something you do while you're working out, and something you do when you're recovering from sex. And so Popstar as a whole, as a brand, is looking to provide those solutions. So the things you need before sex, things you would need to prepare for sex, like our volume and taste enhancer, or our delay spray for premature ejaculation, or an erection supplement, or a testosterone supplement. These things are designed to get you prepared for sex, like going to the gym. Combine them with diet, exercise, decrease stress, better sleep, and then things you can do during sex to improve your performance, and then again, recovery. And so that's where Popstar Volume and Taste fits into this whole equation.
Brian touched on this a little bit already. What this is not is a couple of things. It's not a shortcut, right? So we've talked about some of the factors that can play into semen health. This is not a substitute for lifestyle changes, medical treatments when appropriate, relationship issues that need to be worked on. It's really a tool to go alongside all of those things, not a cure-all treatment by any means. We are physicians. We would not say that this is a replacement for medical care, right? If you're someone who is suffering from erectile dysfunction, having issues with ejaculation, suspect you might have low testosterone, especially if they're present with some of the other comorbidities that we've talked about today, seek out evaluation with a healthcare provider. Make sure there's no other serious health issues going on. If there are, consider medical therapies that your provider may be talking to you, and this could be something that gets added to your toolkit, okay? But it's not meant to replace medical care or medical treatments for some of these conditions. It's also not a miracle, right? So we tell our patients and customers that this is not something you can just sort of pop when you want to take it and expect that it's going to make a dramatic difference. It's a supplement, when we're talking about volume taste, that is meant to be taken every day to have the most profound effect, and meant to be incorporated into an otherwise healthy lifestyle, right? We still want you to get the most out of it, so we would encourage you to get good quality sleep and eat a healthy diet and make sure that you're staying well hydrated. All of these things that we've been talking about that can improve semen health and sexual health in general. So what we do promise is that it's a good quality product and it's backed by real science, and is a doctor formulated list of ingredients that we spent a long time putting together based on the available literature.
So what are we really saying? What we're saying to you is there's a lot of men out there who see Dr. Gonzalez and I in the clinic, and the vast majority of those men, initially in our practice when we first started, had real medical issues, right? And we're looking for solutions. But a lot of men weren't willing to progress to medicine or surgery just to start. And so there's a lot of men in our practices who were looking for over-the-counter natural options to help treat these conditions. But at the same time, as I progressed in my practice, and I think Dr. Gonzalez feels the same way, now I'm seeing patients in the office who aren't having serious medical issues, but we're seeing men who just want to get better with sex. And they want to get better for themselves, for pleasure, for confidence, but they also want to get better for their partner. And so we have always prided ourselves in knowing the scientific options available. There are medicines to fix everything. There is surgery to fix everything. But sometimes we just want our patients to get better on their own, right? To support themselves and to harness the options that are out there before they start a medicine. And so we're not changing the paradigm of medicine. We're creating a smarter patient, a smarter customer, and someone who can be more informed about what they think is best for their body.
All right, the practical stuff. So what are 3 things that you can do this week? I think the first goes back to what we've been talking a lot about, which is communication, right? So have one conversation with your partner about sexual wellness. That would be the first piece of advice I'd give you. And notice I didn't say sexual problems or the issues that you're having around sex, right? Frame it positively. Ask rather than say like, you know, what's been going on lately? What are the problems that we're facing? Talk about I don't know, you could say like, what's one thing we could do to make our intimacy better, right? I think turning the idea on its head and not approaching it from a dysfunction, and this is something I do in my practice. I don't like to talk about sexual dysfunction. I like to talk about how do we optimize sexual health and wellness, right? Framing it that way will make it not only easier for you to start the conversation, but it doesn't make you and or your partner feel like something is broken. It's just, how can we make things better? So that would be piece of advice number one. Number two, I would say like evaluate the basics, right? A lot of the stuff we talked about, things that are modifiable. Are you drinking enough water? Are you getting enough sleep? What does your diet look like? How are you managing your stress? How are you creating moments of intimacy with you and your partner? I think those, you know, evaluating those sorts of basic things that we know can have a positive impact on sexual and ejaculatory health is a good place to start. And then thirdly, what is modifiable? Like consider treatments to address whatever issues come up. Maybe that involves scheduling an appointment with your provider if you suspect there may be some larger medical issue, or, you know, doing your research on natural ways to enhance your performance, and considering, you know, supplements like Popstar to, you know, sort of reach that next level with the sexual experience. So those are my three things to do this week.
Yeah, I think this may be the most important slide in this whole presentation. And what I find in taking care of men for almost 20 years now is that we shy away from conversations, right? We're terrified to admit that there may be an issue. We're terrified to admit to our significant other that we're struggling. And it's the avoidance of that conversation that actually makes the problem significantly worse. And so I'm shocked how often I see men in the clinic who will tell me their significant other has no idea that they're thinking about this. They have no idea that they're seeing me in the office. And that's surprising to me, because we know that a conversation with your significant other significantly beats 1 year of guessing every single time, right? The quicker you have this conversation with your significant other, the quicker you align and you can work together through this to decrease anxiety, increase performance, fix the problem, maximize success, both for you and your significant other. You don't need to talk about this forever. We don't need to perseverate on it. You just need to talk about it once and be open about it. That alone reduces a ton of pressure in the relationship, a ton of pressure on the individual, and creates the pathway forward for success.
Want to leave you with one final truth, and that is you're normal, you're not late, you're doing fine, you're not broken, okay? Things happen in life. Bodies change. You may notice changes in your sexual function. There can be shifts in desire, you know, changes in how you feel about your body and your confidence. That's what's normal. These changes are normal. So if you're experiencing them, don't feel like you're alone or that something is wrong with you. I like to tell my patients to think of sexual health and wellness as a journey, not a destination, right? It's a constantly evolving journey, especially if you're in a relationship with someone, something that needs to constantly evolve. Sometimes things will be great. Other seasons, things may not be so great. And that's what is normal, the fluctuations that can happen. So I think, you know, stay optimistic and know that that you're not alone in this, and that a lot of the stuff that we talked about is modifiable if you're motivated enough. So
that'll bring us to the Q&As. How does erectile dysfunction affect overall sexual arousal?
I'll take that. I mean, I think, when we talk about sexual arousal, we talk about one of the stages of sex for men, right? And that's based upon, a lot is based upon testosterone levels, right? So your total testosterone peaks at around age 30, will slowly decrease with age, and will slowly become lower and lower and lower. Because of that how slow it goes down, and something I call male menopause, oftentimes men don't realize how significantly their testosterone is declining, right? Women who go through menopause will say it's a rapid shift over a couple of years, and they really feel the difference. If you took a man at age 60 and put him in his body when he was 35, it would feel like he's jumping in a Ferrari, because he doesn't realize what he felt like then. And so it is that slow decline in testosterone and arousal that happens over time. And that is also linked to erectile dysfunction. What we know is that around 5% to 10% of men who have difficulty with erections, it's because of low testosterone. Another 80, 90% of those men, it's due to either nerve issues or blood flow issues. But everything kind of works together. And so as your testosterone decreases with age, your blood flow to the penis becomes significantly less, because as we age, our arteries harden. And so arousal and erections are two things that are intertwined, but also happen at the same time just because of age. And so a lot of men who have decreased libido, decreased arousal, decreased testosterone will also, by definition, have some erection issues.
Great. Next question here. How often should men age 65 to 70 have intercourse?
I'll take that. So as much as you want is the short answer. So, I get asked this a lot, whether it be related to masturbation or frequency of sex. There is no right answer, because it really depends on the individual and if they're in a relationship or have multiple partners, what their specific situation is. If you want to have sex every single day, masturbate every single day, and have the ability to do that, I would encourage that. But I also don't think it's helpful for patients to have some idea in their mind of what is quote unquote normal in terms of frequency of sex, because it's so individualized. So what I tell my patients to really evaluate for themselves is how much sex are they currently having, how much sex would they want to have, make sure that that is also in line with what their partner would like. And if they're not meeting that goal for whatever reason, if they're having trouble performing that frequently, then that's where I can really be helpful.
For sure. Alrighty, next question here. Does type 2 diabetes affect sexual performance?
Absolutely. I think both Dr. Gonzalez and I would agree that type 2 diabetes is one of the biggest things that can impact sexual performance. I'd like to consider sexual medicine, testosterone, erections as part of the metabolic syndrome, right? So we always talk about the metabolic syndrome in this country, meaning diabetes, high blood pressure, high cholesterol, all of these things that develop out of our diet, lack of exercise, and stress, right? Just being unhealthy leads to these changes. Testosterone is another hormone, just like insulin is from the pancreas. And when you have a situation where type 2 diabetes develops, a lot of times that runs parallel with testosterone issues. And so having a diagnosis of type 2 diabetes oftentimes is also linked to metabolic syndrome, which is linked to hormone issues. But at the same time, type 2 diabetes can have a pretty profound impact on blood vessels and nerves, right? So you hear people with type 2 diabetes having neuropathy in their fingers and their hands. Well, the penis is no different, right? It's an appendage, it's a distal organ. Just think about it like another finger or another toe. The small blood vessels going to the penis are definitely at risk for nerve damage. They're also at risk for vascular damage. And so type 2 diabetes can have a massive impact on sexual performance. But here's the good news. If you get type 2 diabetes under control, if you get your blood sugars under control, then even though you have a diagnosis of type 2 diabetes, if well controlled, the impact is no different than someone who doesn't have type 2 diabetes. So I stress in my practice that yes, you may now have this diagnosis of type 2 diabetes, but now is the time to get better. Now is the time to focus on getting those blood sugars consistently under 120, ideally under 100, if not possible, at least under 150, and that will stop in the tracks any issues you're having so that you can focus on ways of improving them.
Yeah, I would say also that is often a motivating factor for patients who may have not taken their health and their glucose control serious up until that point, right? Because a lot of the effects of diabetes can sometimes go unnoticed, but when it starts to affect your penis and your ability to have sex, that can really be motivating for a lot of men.
Great. Yeah, and if you're having the other thing kind of on what Dr. Gonzalez was saying is another way of thinking about it is also sometimes ED and low T can be a canary in the coal mine for other issues. And so Dr. Gonzalez and I in our practice will see men who are seeing a doctor for the first time because they're having a little bit of difficulty with erections, and we will diagnose new diabetic patients. And so if you're beginning to have issues, sexual issues, take them seriously because they can be an indicator of a bigger medical issue.
Certainly. Alrighty. Next question here. How do you reveal erectile dysfunction in a new relationship?
I think that's a really tough question, honestly, because I think it depends on the individual, like how long this has been going on. There's a lot of, things to navigate early in a relationship. I certainly don't think it's something that needs to be brought up on like a first date, but if things are progressing in a relationship and it's getting to the point where intimacy is expected or is likely to happen, I think being upfront with someone before the problem happens helps everyone be more relaxed about it, right? I think it's easier to sort of lead with the conversation and say, hey, I've had this issue happen in the past, and I just wanted to, let you know what's going on. I think that's a better way to approach it than to try to have sex, have a problem, and then have to try to explain it afterward, because a lot of times partners can take it personally when it may have actually nothing to do with them. And so I think if you set that story up before the sexual experience, it just goes over better. And especially if you've gone through the steps of having this evaluated and you've been diagnosed with, XYZ problems, and say like, I'm working on these things with my doctor to try to find a solution, or these are the things I have to do so that I can have a good quality erection or have a good sexual experience. I think that can be really disarming for partners and make them not interpret what's happening as some fault of their own.
Alrighty. Let's see. Next question here. How do you address timing issues so that disappointment and resentment do not occur?
I'm assuming timing issues pertains to lasting time, right? And so one of the most common male sexual issues that we encounter, that men experience, is premature ejaculation. And if by timing they mean the inability to last long enough, which is typically the one that leads to distress, I always tell my patients one thing flat out, that if Mother Nature or God, whoever you believe in, put us on the planet to have sex for 3 hours, we wouldn't have reproduced, right? And so having premature ejaculation is evolutionarily advanced. There's nothing wrong with you. If you can last for 30 seconds or 1 minute, it may be a problem in your relationship, but from a survival of the species standpoint, you're doing quite well. That said, as doctors, we have to treat the patient. And so the most important thing for men to realize is there are solutions out there for these things. If you can't last long, then we can work with you. There are things you can do. And the most common thing that men use is a lidocaine delay spray, right? So Imagine it's Friday night. You've been dealing with premature ejaculation. You're very worried about the sexual experience. Imagine it's this Saturday and it's Valentine's Day and you're getting home from dinner with your partner and you're worried about it. Well, arming yourself and educating yourself with solutions allows you to try things to find success. And so what I tell my patients is find a very good delay spray, one that's lidocaine based, one that has no taste or no smell, so that your partner is unaware that you're using these things, especially in the beginning. Slip into the bathroom, spray it on the penis, allow it to absorb, wipe off any excess, and then come out of the bathroom and initiate foreplay. And within 10 to 15 minutes, these delay sprays, these lidocaine-based delay sprays, they can increase lasting time from 1 minute to 5, 10 minutes. And so when it comes to timing issues, a lot of times guys come in extreme distress, not realizing that there's a lot of really good options out there. And so the first thing to keep in mind is you're not broken. There's nothing wrong. In fact, the argument could be made that you're more advanced. But once you've gotten over that and you accept it, then the next step is finding a real solution and finding a sexual medicine doctor to walk you through the options, whether or not it's working with timing, training, using delay sprays in the moment, even some medicines that we have that you can take on demand or daily. There are real solutions to help this, and there are real solutions that are going to work.
All right. Perfect. Next question here. When trying to cope with your partner's erectile dysfunction, what alternative ways can be used to enhance the relationship?
That's a good question. I think, first of all, I think in general, we put way too much focus on penetrative sex, right? So that's where a lot of men get very discouraged if they have erectile dysfunction, because if you can't get a fully rigid erection, you are not going to be able to penetrate your partner. That does not mean that someone who has the inability to penetrate cannot have an enjoyable sex life. Does not mean that they cannot have pleasurable sex, and that does not mean that their partner can't have pleasurable sex. So I think it's about creating other ways of being intimate, right? There's sensual touch. There are things like tantric practices. There is massage. There are non-penetrative types of sex, oral sex, lots of different things that you can do that don't involve penetration and that don't require a fully rigid erection, that can still make the sexual experience incredibly enjoyable. So I would start by sort of trying to think outside the box and say, if this isn't working for you right now, what are other ways that we can try to create intimacy that don't involve penetration?
I agree.
Certainly. Alrighty. Next question here. I miss the desire for sex. My testosterone is low, but I cannot take TRT as I have AFib heart issues. Any suggestions?
When we're talking about testosterone, there are two major things we worry about from a side effect profile. And I'm happy to report that the science behind testosterone replacement continues to evolve every year, right? What we used to believe was a potentially dangerous hormone replacement therapy. Each year that goes by, we find it to be safer and safer. In fact, not only that, more beneficial for total metabolic issues, not just sexual side effects. And so the two things we worry about in all patients who are on testosterone replacement therapy are, if you develop or have prostate cancer, you need to be careful with it, because testosterone is the fuel for certain prostate cancers. And if left unchecked, pouring gasoline on that cancer could be dangerous. It's not the case for all men, and it does not cause prostate cancer. But in that situation, you need to be very careful. And if you're on testosterone therapy, you should probably get a blood test called a PSA done periodically. The second thing is, we know testosterone will tell the bone marrow to turn on. When your bone marrow turns on, you produce more red blood cells. If you were an Olympic athlete competing this year in Italy, it would be a good thing for you, because the more red blood cells you have, the more oxygen you carry, right? That's why Olympic athletes, that's why Tour de France athletes have abused this since 100 years. However, the reason why it's dangerous is not because it's going to give you an increased risk of heart attack or stroke. It's because it will cause your red blood cells to potentially get too high. And if left unchecked, that could make your blood too thick. And so anyone on testosterone replacement therapy, they should have their blood levels checked. In fact, I actually recommend that once or twice a year, if not more, they donate blood, whether or not that's to the Red Cross or they donate blood at a lab where they get a therapeutic blood removal. That reduces the risk. I'll let Dr. Gonzalez also weigh in, but I don't have an absolute contraindication in my patients for atrial fibrillation. If you have atrial fibrillation, typically sometimes you're even on a blood thinner called Coumadin or Plavix, and that will thin your blood, reducing the risk of heart attack or stroke or red blood cell growth. I do not hesitate to put patients with atrial fibrillation on testosterone replacement therapy in the forms of gels, injections, or pellets at all. Now, that said, let's assume your cardiologist disagrees and says, Dr. Steixner and Dr. Gonzalez are wrong. You can't start it. There's a medicine called Clomifene, and that's designed to work on the level of the pituitary gland to stimulate a natural production that is not synthetically giving yourself testosterone, right? An alternative to testosterone replacement therapy. But if push comes to shove and all of these medically based options are off the table, then we go back to the thing this conversation, the item that this whole topic was about, is that a healthy diet, exercise, sleep, and supplementation with a testosterone booster in the form of a multivitamin designed to focus on testosterone can actually have a pretty impact on how your testosterone increases.
Yeah, I mean, I would just add to that. There was a large clinical trial of over 5,000 men published in 2023 that looked at high-risk cardiovascular patients, including patients with atrial fibrillation. There was a placebo group, and then there was men that were treated with transdermal testosterone, and they found no difference in cardiovascular events in either group, which says to us that at least with transdermal testosterone, even in high-risk cardiovascular patients, that there's no increased risk of adverse cardiovascular events. So I think that goes to speak to what Brian was just saying, that we would feel very comfortable putting someone with atrial fibrillation on at least transdermal testosterone. And that's a study, as I mentioned, called the Traverse trial. Maybe something to have a conversation with your doctor about. I agree with what Dr. Steixner said about all of the lifestyle stuff as well. And then the last thing I would add is that for libido specifically, there are non-hormonal medications that can sometimes help with desire. They're not always as effective if someone has low testosterone and that is the primary driver of their low desire. But if someone absolutely cannot be on testosterone replacement therapy for whatever that reason may be, then it could be something worth considering. So there are medicines that increase dopamine in the brain. Dopamine is an important neurotransmitter for desire. And so we use some of those medications off label to help with desire that is either not hormonally mediated or in patients who cannot be on testosterone therapy.
Perfect. All righty. We're going to move along to some questions that were submitted in the chat to get these answered for our live viewers right here. So first question is, what is the best non-surgical treatment for climacturia, if anything, post-radical prostatectomy? Is there any treatment other than an artificial sphincter?
Yeah, I can handle that one. Climacturia is a very common side effect following removal of the prostate. When the prostate is removed, it removes one of the primary mechanisms of continence in men, right? So the prostate for men, maybe a man in his 50s, 60s, or 70s, has his prostate removed and has relied on that prostate for quite some time in order to not leak urine. Now, once that prostate is removed, the combination of removing the primary mechanism of continence as well as having a sphincter muscle in there that now becomes the primary mechanism but wasn't used for 10 years leads to a situation where when you cough, laugh, or sneeze, you may leak a little bit of urine. At the same time, when you orgasm, At that point, you actually have a relaxation of those muscles and you may leak. And so one of those options at the extreme end is an artificial urinary sphincter, or a cuff that goes around that has a constant pressure to it that prevents that leakage from happening. And that when you push the button that releases it, it opens it up and you may urinate. Now, that's an extreme first step for a symptom like climacturia. And so what we typically recommend is, and something I recommend in a lot of my patients, if not all of them after robotic prostatectomy or open prostatectomy, is pelvic floor physical therapy. And so the pelvic floor is a unique set of muscles that is often neglected in men. And so meeting with someone, a physical therapist who specializes in the pelvic floor, can work wonders in strengthening that muscle that becomes the primary mechanism of continence. And I'm blown away on a daily basis by how many patients I'll send to pelvic floor physical therapy who come back 3 months later, 6 months later, and are profoundly better. And it doesn't mean you have to go 3 times a week. If you go once or twice and learn the proper techniques for these exercises, go home and work on them, and then go back and get better and better and do them reliably, you will have a huge difference in how this feels, and you will have a huge difference in how your performance is. I also will say that developing some cues to do these exercises is key. So I tell all my patients, every single time you pick up a fork or a spoon, before you start to eat, pause and do the exercises that the pelvic floor physical therapist taught you. That way you know at least 2 or 3 times a day you're doing a workout. No one will notice you're doing it. Just take a time, take 10 seconds, take 30 seconds, do a round of exercises, breakfast, lunch, dinner, and you will notice within 3 to 6 months, if not 9 months, that the symptoms are really getting better. Now, between pelvic floor physical therapy and an artificial urinary sphincter, there is something called a male sling, which is a minimally invasive option, and that allows you to have a sling placed inside of there that creates a backbone so that when you have that increased pressure with ejaculation, it actually doesn't lead to leakage.
Perfect. Thank you for answering that one. Alrighty. Next question here. A bit of a review we covered earlier, but how can low semen be restored?
I think it depends on the cause, right? So you want to kind of look into some of the causes that we talked about, right? Like if it's something as simple as hydration, increasing your fluid intake can definitely have a positive impact. If you think it may be age-related or hormonally related, that's something that you can test with a healthcare provider, and sometimes putting people on not usually exogenous testosterone, but a medication like Clomid or even HCG, which are medicines that stimulate endogenous productions of testosterone, can sometimes help with semen volume. Certainly if it's medication related, right, like stopping that medication will usually normalize the ejaculatory volume again. So I think it's, when you're talking about how to restore, it's important to understand what the potential causes of it are and which of those are modifiable.
Great. Alrighty, we have our next question here. Another review from what we covered earlier. This person wants to know if you said that Flomax can decrease semen volume.
Yeah, I mean, absolutely. Not only does it decrease semen volume, it's probably one of the top 2 side effects that it does cause. And keep in mind, there are millions of men in this country who take Flomax. It's a medicine that's been around for decades. It's a medicine that works very effectively with almost no serious side effects. And the impact on Flomax on your urination is wonderful, right? And so I use Flomax in my practice all the time for men who are having the initial symptoms or worsening symptoms of an enlarging prostate that comes with age. And so the way Flomax works is I like to say that the prostate kind of wrings the neck of the bladder, right? It's kind of squeezing the neck of the bladder, making urination difficult. And as that squeeze gets tighter with age, urination becomes more difficult. The bladder has to work harder and harder to push it out, and that muscle gets thicker, giving you increased urgency, increased frequency, weak stream, and getting up at night. Flomax relaxes the muscle of the prostate. And by relaxing in the muscles of the prostate, it loosens that grip, and your stream can become weaker and your bladder does not have to work as hard. But as it works to relax the prostate, it works to relax the ejaculatory duct. The ejaculatory duct is no different and requires the same muscles to propel the ejaculate outside of the body and travels right through the prostate. So anytime you're treating the prostate with these medicines and you're getting relief, you have to assume that you're having some negative impact on the man's ability to ejaculate. And so Flomax, in my practice, is one of the largest killers of ejaculation. Now, for some men, that's a fair trade-off. They're comfortable with that. But I see a lot of men in my practice who don't realize it's the cause. And when we finally have a conversation about it, we can modify that medicine, add some supplements, make some dietary changes, get them urinating well, and also fix their ejaculation.
Perfect. Alrighty, I think we have time for another question or two. This one's also from the chat, but this person asked if you have any controlled data about Popstar and its effectiveness. Trial data they asked about.
So we have done subjective studies into Popstar, and we have looked into how patients perceive it. The problem with semen volume and semen taste as a supplement is that getting an institutional review board to approve testing in this regard is near impossible, right? If Josh and I were trying to get a new cancer therapy approved, a supplement that may modify blood flow for cancer treatment or something like that, we could accrue patients and study that. Whenever it comes to the transfer of semen or bodily fluids, it's almost impossible to do a clinical trial on it. But what we do have is individual clinical studies supporting the ingredients that we use and the doses that we use, showing that each of them have an effect, and we put those together into one supplement that we back.
Perfect. Thank you for answering that one. Alrighty, I think we're gonna have time for one more question. So last question tonight will be this one right here. I'm a male in my early 70s. Oftentimes I fail to orgasm. What could possibly be the reason for this?
So that's a really common condition. We were kind of alluding a lot in this conversation to premature ejaculation. Another very common issue that comes up with ejaculatory health is delayed ejaculation. Probably one of the hardest things I see in my practice to treat, because there's no one size fits all, right? Again, delayed ejaculation we know is more common as men get older, but it doesn't happen to some men, and it does to others. There can be hormonal factors, there can be medical comorbidities that can cause problems achieving ejaculation. Certain medications can make it harder to come. So there's lots of different things that can play a role, and all of the sort of tools in our toolbox that we have to help somebody really have to be sort of done in a trial and error sort of way, or specifically targeting problems that come up with that individual, right? So if we suspect there may be a hormonal issue, we can put them on hormone therapy. If it may be a behavioral problem that they're not creating enough sensation on their penis, we can, have them use toys and vibrators that can make it easier for them to ejaculate. There are, again, sort of neurotransmitters that are really important in being able to cross that orgasm threshold. And so sometimes we have to employ medicines that work on sort of brain chemistry. But it can be challenging. And sometimes it requires more than one medical treatment. And so, I would say if you're having that issue, start with a conversation with your provider, try to find a sexual medicine specialist who is familiar with treating delayed ejaculation and isn't just going to sort of tell you that's a fact of getting older and there's nothing that can be done about it. Because until you've exhausted all of these sort of options, I think it's worth trying if it's something that's important to you.
Okay, well, we want to thank everyone for coming out. Wish everyone a happy Valentine's Day. Hopefully you gained a lot out of this meeting, if nothing else, knowing that there are solutions out there and that communication is key. for Dr. Gonzalez and myself, we want to say thank you, and everyone have a nice evening.
Yeah, thanks, guys.
If you'd like to learn more about couples intimacy health, you do have a few options. You can visit menmd.com to learn more about intimate health, including key factors that impact fertility, diagnostic testing, and evidence-based interventions by navigating to our main menu to the Semen Health Condition page. There will also be more resources on the Resource Center on menmd.com. Here you can view instructional videos, guides, expert articles, and more. And if you are interested in purchasing anything discussed on this talk, you can now save up to 20% when you shop our brand new His and Hers Intimacy Bundle, featuring the very same products we just talked about. On behalf of the entire MedMD team, we'd like to thank you again for listening in and watching this online clinic, and we look forward to seeing you at the next one.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.